Hello everyone, I'm Whitney Ortiz with Eliana's Light, and I'm here today with Eileen Walters, nurse and program manager with the Beyond the Spectrum program at Children's National Medical Center. Thank you for joining us, Eileen, for this conversation with a caregiver. Can you please start by sharing a challenge that you and the children who you were supporting were experiencing?
Sure. So many years ago in 2011, when I was a nurse navigator, I was assigned to support children with complex healthcare needs with navigating services here at Children's National. And I was assigned my first patient with autism who had a newly diagnosed chronic gastrointestinal disease that needed ongoing treatment that she's going to need for the rest of her life. And in working with her, I had never worked with a child with autism before, and so I searched for information through all of the teams and the care providers, nurses, doctors, to get more information about what do we do when we have a child with autism who needs medical care? How do we help them and their families with the autism piece of understanding care? And I didn't come up with very good information or very good strategies or any scientifically based ways of helping children with autism in their medical care. And so I just continued to help support this patient, and I saw the challenges that she faced as a young girl needing IVs, blood draws, infusions, examinations, interactions with multiple people, transitions from one department to the next. And I saw how this all of the care that she was receiving impacted her ability to cooperate to the point where she was unable to even sit still for a temperature. It was difficult for her to even enter the hospital. She was so traumatized by having all of these people and procedures being performed on her without having a good understanding of what was happening.
Thank you for sharing that example. Which strategies or approaches have you used since that time with the children that you've been supporting that you have found have made a really positive difference before, during, and or after medical procedures?
So working with her was such an eye-opener, and she's an amazing young girl, and her family and the team were amazing in helping to support her through her experience. So one of the things I wanted to do was to get more information about what her specific unique needs were. How does she communicate? What is her typical behaviors? What are her needs? What are her likes and dislikes? Just what are the things that we need to know about the way that she communicates to others? How does she receive information? What are her sensory needs? So getting more information about the child and the family and their needs as a whole, we were able to identify accommodations. So we do a lot of identifying accommodations. We do a lot with preparation. So helping the kids understand ahead of time what to expect. Kids with autism are visual learners, and so we use a lot of visual supports using pictures. We use teaching stories, visual schedules. We do role play, home practice. All of these things all help a child prepare for their medical encounter. During the medical encounter, we use the information that we gathered from the family and the child, and we communicate that to the team members so that they're aware of what the special needs are and what the accommodations are. Some kids are fine in a busy waiting room. Some kids absolutely cannot sit for more than a few minutes in a busy waiting area. So we communicate to the teams like, these are things that they'll need. They need a quiet waiting room. They need some sensory items to keep them occupied. They need to use visual schedules or visual supports to help them get through their doctor's visit. We use just different strategies during the visit. We also work closely with child life, music therapy, art therapy, even healthy humor. We'll ask teams to come in and provide support if we know that that's going to benefit the child during their visit. And then afterwards, after their visit, we really want to make sure that families plan for a reward for their child so that the child knows that the visit's over and they have something that they really wanted to have, something that will provide them with the with I don't know how to say it with the encouragement to keep doing a good job, that they did a good job. And then we also ask families to try to remember what worked and what didn't work. We want the families to take note of that so they can share that with their teams in the future or make different arrangements when they come back before any type of medical visit. And then we also ask that you keep practicing. If you have visual supports or teaching stories, which are similar to social stories, if you have those, continue showing that to your child when it's not necessary for the actual visit so that they can just get used to it. And then the next time they have their blood draw, they will have had all those experiences of learning it before they actually have to go in and do the medical care.
That was awesome. Thank you, Eileen, for all of the documents and strategies that you've been developing. And we're going to have a link to them so other practitioners and parents can access them. Can you share now a couple of other examples of like before and after with other children that you've been supporting over time?
Sure.
And also if you have any concrete takeaways for both practitioners and parents for this conversation, that would be great.
Okay.
Thank you.
So going back to the young girl that we first started taking care of, we did use a lot of visual supports and environmental accommodations to help her when she came in for her visits. And so this is a child who needed, frequent medical visits, who now is able to go to the doctor's office and not have the level of accommodations that she had before. We don't need security to help get her into the building. We don't need a wheelchair to have her sit in when she gets into the parking garage. We don't have to have her receive medication so that she can have a blood draw. She can sit down in a chair, get her blood drawn, get up as soon as it's done, and walk out and know that she's completed that visit. So we really see the change in the children over time who have to have continued medical care. So if you have a child that has to have blood draws a lot or has to have frequent EEGs or just different medical procedures, over time, the more that you give them the support and encourage them and allow them to communicate their wants and needs throughout their medical care, they're the ones that are able to grow up to be healthy adults because they're able to take on that medical visit when it comes up.
Thank you, Eileen. We really appreciate your time here, and we will have a link also to your contact information. So if any parent or practitioner would like to learn more and to access any additional resources that you are planning to develop, they can do so. So thank you so much for your time today, everyone.
Thank you.